Periodontal therapy is needed when gums are inflamed with pocket formation, when there is progressive bone loss, or when roots are exposed. Mild cases are treated non-surgically with scaling and root planing. Severe cases need flap surgery. Left untreated, pockets deepen, infection spreads, and teeth are lost. According to the American Academy of Periodontology, bacterial toxins from chronic periodontitis can trigger heart disease, stroke, diabetes, dementia, and even cancer. Gum health is directly linked to your overall health and lifespan. Let's set realistic expectations. Expected side effects include pain and swelling for 3 to 7 days, root sensitivity that improves over weeks, and some gum recession as inflammation resolves. Warning signs needing immediate attention are fever, pus, and persistent bleeding. The goal is to stop disease progression and create a cleanable environment. Tissue regeneration has limits. 3 keys to success: no smoking, thorough home oral hygiene, and maintenance visits every 3 to 4 months. The treatment process has 5 steps. First, we examine with x-rays and probing to measure pocket depth and bone loss. Second, local anesthesia. You feel pressure, but pain is minimized. Third, scaling and root planing removes infected tissue, plaque, and bacteria for mild to moderate cases. Fourth, for severe cases with deep pockets, flap surgery opens the gum, debrides the bone, and sutures it back. Fifth, we reassess at 6 to 8 weeks. The goal is to halt periodontitis and preserve your teeth. Gum grafting uses 2 main techniques. Free gingival graft takes tissue from the palate to widen the band of protective gum and make hygiene easier. Connective tissue graft harvests tissue to cover exposed roots and restore aesthetics. The palate donor site causes 1 to 2 weeks of discomfort. A protective stent is available. Long-term, grafted tissue is not permanent and some shrinkage is possible. The goal is keratinized gum around natural teeth and implants for long-term hygiene. Follow these instructions carefully for proper healing. Take all prescribed medications as directed. Begin gentle rinses 24 hours after treatment. Apply cold compresses the first 24 to 48 hours. Eat soft foods and rest with your head elevated. Don't smoke or vape. This severely impairs healing and is the biggest cause of failure. Avoid hard or hot foods. Don't brush the surgical site for 2 weeks. Don't touch it with your tongue, and don't take any medication on your own. This is your emergency reference. Persistent pain beyond 3 days that isn't controlled by medication. Return for a visit. Signs of infection like fever, spreading swelling, or pus. Return immediately for antibiotics. Severe sensitivity can be treated with desensitizing agents and fluoride. Excessive bleeding after 2 hours of gauze pressure, come in immediately or go to the ER. For graft failure, in-office evaluation is essential. To prevent recurrence, keep your 3 to 4 month maintenance visits. Any questions we are ready to answer. Thank you.